it's often quite easy to find good data on the general risk of a type of operation.
Right, right.
But really, that's not what you care about. You care about the risk of that operation in the hands of the guy who's treating you.
On you particularly,
Yeah.
right?
There is our Weiss ring right there. And it's kind of sitting flat. And then also, follow the light over here. This is the other crinkly little membrane, just like a little plasticky food wrap, a little sheet there that's kind of sitting right there. So in the camera, we'll see these two green beams, two little light laser focusing beams, kind of bouncing around back and forth. And when they're superimposed right on top of each other, that's where that focus is. I might start with this one here. So the first one, I don't know how to prepare you for it. It's a clicky, snappy sound, a little bit of a light show. That's basically it, and that will make that piece of plastic dance a little bit, bounce around a little bit.
Yeah, see bubbles.
Yeah. So what people will sort of see as what appears as debris that's falling, those are actually the gas bubbles rising.
Hi, I'm Dr. Johnson, the floater doctor, and I have not done one of these in probably 10 years or longer, which is an interview. I've always had a lot to say. I monologue, I do my long narratives, but I think it's really valuable to bring an actual real person, a real patient in and have a little chit chat. I have nothing prepared, but I'll introduce Ralph. Ralph is about my age, a year younger. And he came to me, today's Monday, he came to me on Thursday, where we initiated a treatment. And I just wanted Ralph, if you would, just kind of explain a little bit about like the human interest side of it, not just the technical stuff. We can go there as well, but the human interest side of the struggle with the floaters, how it affected his either professional or personal life, interferes with the activities of daily living and stuff like that. So just riff a little bit on what your experience has been, if you will.
So I guess I was fairly typical for what I now understand to be PVD. That a couple of months ago, suddenly had very disruptive floaters in my right eye, very annoying. I'm retired, and one of my passions in retirement is actually photography. So of course I'm very sensitive to my eyesight. I mean, everyone is sensitive to their eyesight, of course, but it was diagnosed quickly. I obviously got some peace of mind initially that nothing worse was going on with my eyes, but yeah, I mean, I live in New Mexico, and I was really offered no solutions other than vitrectomy.
Right.
Which was quite disappointing, really. I mean, because vitrectomy, it's a fairly safe procedure now, but the whole idea of an invasive operation is quite yeah.
So what Ralph did not mention is he has a very strong science background, and you retired from what?
I was a research scientist in molecular biology and genetics, so I don't have any background in medicine, but I can read a research paper. So whenever faced with any health problem, I take a very analytical approach to it.
Which actually a lot of my patients do. I mean, I have sort of a characteristic, prototypical patient, which is male more than female, but usually very well-educated, high-performing individuals, either working or retired. That doesn't matter so much, but coming from a lot of software engineers, in fact, the patient I just treated in IT, a lot of software engineers, coders, professionals. I've had pilots, a radiologist. I've had entrepreneurs, all kind of walks there. But I think these are people that are high functioning, high expectations for the quality of their life and their quality of their vision, whether it's an avocation like photography or your profession as a microbiologist. And so I'm really honored that these people who can really kind of deep dive. Again, you don't have your professional background in medicine per se, but on the other hand, it's analytics. So if the information I have on my website and on my YouTube videos and any communication I have with people, I really hope that it stands that test of someone who might be kind of coming from even a little bit of a cynical or like, I don't know, like I gotta see what's going on here. hopefully kind of stands that test. And speaking of with the research, Ralph's first gift to me was a couple of articles that he brought in, and this is what I love about the people on Reddit as well as a lot of my patients. They'll introduce me to things that I just haven't been sitting poking around on the internet to find. So he brought me an article from China and an article from Malaysia, and I can talk a little bit about those in a few moments. But so you get a quick diagnosis. You go to one or a couple doctors or so, and they usually say, I think in your case, either do nothing and then learn to live with it, or we have this other thing, which is this surgical intervention. So how did you find me?
So the process I went through was, as you say, reading the research. I immediately came across laser ablation, which, like I say, I mean, I was actually quite annoyed that my retinal specialist had never mentioned to me as even an option. I mean, maybe he just doesn't like it. I mean, I haven't really asked him because I'm not sure how much I value his opinion at this point. But it will be one thing to say, I don't like this procedure, you should do this. But to simply not mention it, I felt was a bit, well, anyway. Yeah. It's fair to say up until 2015 or so, the literature on laser ablation was very mixed. Certainly wasn't conclusive that this was a great way to go about things. Partly because it's very difficult to measure objectively
Absolutely.
what the improvement is. But what I did find is that more recently, in the last 3 or 4 years, there are some really pretty good papers from people who, reading between the lines, I think, are doing a similar thing to Dr. Johnson in Far East clinics, where they're now sort of specializing in this. And these are guys who are sort of doing it every day and have got good skills in it. And these aren't huge sample sizes, but they're not nothing. I mean, they're sample sizes of 50 plus.
Yeah.
Zero complications, very good subjective outcomes. I think something like 75% patient satisfaction plus, right? If not higher.
And there's a lot of really good in that. Although it's all competition for me, I mean, it's still good for humanity for that more people are starting to say, hey, there's a problem of floaters. What do we do about it? That's a whole different story. But I think that's a big change from when I started doing this, 17 years ago now, where I was, working in the shadows, and still the lights are on. I have good lighting here, but still really working in the shadows, both literally and figuratively. So that the fact that more people are starting to recognize, and the academic institutions started to say, okay, well, maybe we need to do something about this.
Oh, but before talking about the research, the other thing I should say is, so I was fairly quickly enthusiastic about at least the possibility that this was a good idea. Mm-hmm. But then I started to ask, well, why wasn't this offered to me? And just a quick bit of Googling, I discovered something a bit odd, that like literally nobody anywhere in New Mexico is offering this. Mm-hmm. But there are like a dozen places in Colorado that are offering it, all saying very similar things. I mean, okay, the New Mexico population is that much smaller, but usually if there's 10 guys in Denver, there's at least one guy in Santa Fe or Albuquerque offering it.
You would think.
So I started to get, this is a little bit weird. And I actually talked to my ophthalmologist about it, and she really had no idea either as to why this was the case. Because the fact is, a lot of ophthalmologists do have lasers that they're using for other purposes. So anyway, to cut a long story short, after doing more research, and for some reason I'd never thought about Texas, I mean, although it's equally close, I did end up finding Dr. Johnson. And as soon as I started reading, like literally the first paragraph of his website, I realized this is the guy I want.
Thank you.
Because with any medical procedure, you want the guy who just does this every day, all day, and has done 10,000 of them, not the guy who just learned to do it last week. I mean, this goes without saying, but to actually try and find this information as a patient is often incredibly difficult. People are just very reticent. Well, obviously the ones who aren't very experienced are reticent, but it's just very hard to get clear data on, it's often quite easy to find good data on the general risk of a type of operation.
Right.
But really, that's not what you care about. You care about the risk of that operation in the hands of the guy who's treating you.
On you, particularly.
Yeah.
Right.
Yeah.
And that introduces a big challenge of this practice. Is a number of aspects you touched on. One of those is there is no instruction or course of instruction or teaching or training or skills transfer or lab or anything for this. So the big sea change, I think, in the last 10 years was really sort of driven by LX. I have 2 LX lasers. I've worked with LX, my entire career with this, and very, very good company. And for 10 years or so, they were really pushing their newer laser with their website. You can treat floaters. You just need the laser. Now I have a problem with that. But I think if I were to criticize LX for anything, is they were taking advantage of the marketing opportunity, but not really dedicated to teaching, training, and certification. And the reality is, it just doesn't exist. So anybody,
I mean, and this is what I'd already suspected,
Yeah,
even
right,
though I saw your website. I suspected this, that if you've got like 10, 15 guys in Colorado offering this
Right.
and nobody in New Mexico,
right.
is the explanation just that some commercial operator is promoting this as a thing that people should?
Right,
and
right.
I think that is exactly the explanation.
And so there's no standardization for the treatment. And basically, it's a doctor saying, "Hi, I have a YAG laser. I was told I can do this. What could go wrong?"
And in many cases, they can also say perfectly honestly, "I have been using a YAG laser for 20 years."
That's true.
But just for completely different purposes.
That's true. You're just kind of pushing the focus a little further back in
Right.
the picture. Yeah, that's all. And so it really puts the burden of research on the patient. As far as my practice here, I'd say probably 95+% of my patients found me on their own, researched on their own, oftentimes coming to me in spite of their doctor's admonitions. You don't want to do that. Like, don't you think there's a reason we don't do it here? And a little bit of academic elitism involved sometimes. And so, I mean, that's a really big burden for people to do that. And if they're local and trusted and otherwise super competent doctor says, don't do that, I think it just sort of ends right there. So it really does take a special type of person to say, okay, thank you, doctor, but I'm still going to do my own research. And that brings some people to me here. And the other thing too is there's no standardization for treatment. There's no syllabus or cookbook or anything that says here's the treatment algorithm. So everybody just kind of finds their own pathway. In fact, the reason I'm holding these studies is I found them kind of interesting. And you're right, there was a pretty good sample size. The absence of complications, and I think a surprisingly high satisfaction rate. Not because the procedure can't bring satisfaction, but because the treatments were so light. Compared to what I did. And this is where I'm going to look through this over the weekend. And I think, the average, at least in this Chinese study, the average laser shot count. And basically what they did is they did one treatment and it averaged 250, about 300 shots of the laser and then no more. Then they waited, I think, 3 months and they said, well, what's your satisfaction? So subjectively, they did some objective measurements.
I think one of the studies did more than one treatment, right?
I think the Malaysian one perhaps.
Yeah.
But it was the one here that I have all highlighted here. So they did basically one treatment with about 300 shots. Now, you came to me, handing these to me. I said, well, I'll get to them later. And I did my examination, did a long consultation, long discussion. And I took a look in there and I'm like, bravo, we have classic Weiss ring floater, PVD, another little crinkled bit of plastic over here. And I'll show some of the video of that treatment. And just classic. And I don't get those very often. I get really complicated stuff.
Okay, so this is day number 2. We did a first treatment yesterday. And Mr. B here comes back saying, what would you say was about 75%?
I'd say at least.
Yeah, at least 75% better, and describes some scattered little bits and pieces. And I was explaining to him, at the end of a treatment, it might look pretty darn clear. And then some of these little fragments, like there's one right there, these little fragments will kind of find their way back into view. So usually, especially after very treatable floaters like the Weiss rings and such, seeing a few little scattered bits and pieces is very, very typical. They'll get pushed out into the periphery. I might not see them at the end of the procedure and then come back on day number 2 like today and they're like, oh yeah, there's plenty of room for cleanup of that same stuff. So we'll go after that there. And so basically what I'll do is I'll just kind of work my way through the clock hours and just basically whatever I see I'll pick at. They're usually pretty small, so a few shots at them would usually be enough to get rid of it.
So I was really enthusiastic to treat this. I went into it with a very high confidence as far as what I could deliver for you, with a high expectation for yield and low risk and all that. And I proceeded to do a first treatment of 1,221, I think it was 1,221 shots of the laser. And I came back on day number 2 and did another, what did I do on day number 2? Another 400 or so. So already right out of the gate, I'm doing about 4 times what they did. Now, I'm not saying that every doctor should do that, but I have 17 years of building up that level of confidence and kind of knowing what the eyes can tolerate, what they can do. So if they got that degree of satisfaction out of what I would consider not quite homeopathic, but a very sort of very, very light conservative treatment, then as the doctors who do enough of this and do a lot of this can kind of build their confidence and build up to that. And then incidentally, I had a conversation with a doctor out of the Carolinas, just asking for advice. And he said he usually does about 300 shots as well. So I know I'm doing something a little different. And again, it kind of puts the burden on the patient to kind of sort out who do I go to, what's legit, and how do you vet that doctor's experience? If they say they've been using the YAG laser for 20 years, it's no lie, but they're doing capsulotomies. Anyway, so we did that initial treatment and did a couple treatments Thursday and Friday. And tell me briefly about maybe the treatment experience and the recovery, both immediately and over that course of 24 hours or so. And then where are you right now as you're dilating? We're going into treatment number 3. Where are you right now as far as your subjective assessment of where we are and what we still need to do, hopefully?
So the treatment itself, completely painless. I mean, just a bit of a bright light. I mean, I know some people are a little bit squeamish about things touching their eyes, but it's really, I mean, honestly, I think very, very few people would have any problem with discomfort with this at all.
That's true.
I'd say after the first treatment, I mean, it's quite astonishing how your brain does teach you to ignore it.
Mm-hmm.
So even before I had any treatment with this Weiss ring, what was incredibly annoying for the first couple of weeks, my brain was actually teaching me to ignore, even though objectively it was still there. So it was still a real problem for me. So I'm fairly confident that 75% improvement figure is an underestimated improvement, because I think, when you have a change in your vision, you're much more sensitive to it for the first few days.
Right. And as I was suggesting earlier, is there's a psychological aspect of while you're here for this purpose, for this treatment, that it be natural to be kind of hyper vigilant and kind of looking, because you want your own feedback. You want to be able to convey some of that feedback to me. So you might say, well, there's a little this and there's a little this, and very well it will be there. But I think it's really more interesting what happens when you go back home after a couple of weeks or so, sort of practically and functionally. At the end of the day, if you're like, I haven't been thinking about my floaters, or like, oh yeah, there's still a couple little bits and pieces, and which kind of goes to, well, what does success with the laser treatment look like? Generally, I spend a lot of time managing people's expectations, and I'll never say 100% or absolutely restore, remove, eliminate. I never say these sort of absolutes. The goal is to get things a lot better, functionally a lot better, and that means different things to different people. I never know what's going to walk through the door, how complex things are. But if we can get it a lot better without having to consider the vitrectomy, then it's kind of a win. Because and I don't look at the vitrectomy, by the way, as my direct competitor. And so I won't disparage it out of the gate and demonize it and vilify it. I kind of look at it as, and there are times I will actually recommend it, but I kind of look at it as further down the spectrum for both invasiveness, aggressiveness, risk of cataract and such, but also for results. Like, it is definitive, it is a cure. So I kind of reserve that recommendation now and then. But when someone comes in with a classic Weiss ring like you, the likelihood of you having to even get to that point to consider it is not likely. I think we've made very good progress. We're going to do treatment number 3, do a little cleanup today. I don't know what else to ask. Do you have any sort of general sort of parting advice for those who might be kind of sitting on the fence and considering, or trying to do their due diligence as well, like you were?
I mean, I'm not sure what to say other than, I mean, I'm totally confident I made the right decision.
Yeah, that's a good vote of confidence.
Both about the procedure and about where to come for it. I mean, quite honestly, having discovered what I have discovered about how, I think in Colorado, the procedure is just being pushed by the equipment manufacturer as a sort of source of extra revenue for ophthalmologists. I mean, the advice there to be very ultra cautious about it probably isn't wrong.
Yeah. I agree.
Because, I mean, at the end of the day, somebody is shooting a laser into your eye, and, you don't want to be going to a guy who's doing it for the 5th time.
Right. You don't want to go to dabblers. You don't want to come to me for cataract surgery. I've done cataract surgery in 20 years. So, I know to stay in my lane. But yeah, and that's that should be sort of self-regulated by the doctor to a certain degree. But again, as a patient, it's hard to make that decision sometimes. And I also understand the tendency to say like, oh, if there was somebody right in Santa Fe, it's like, oh, well, that person did my mom's cataract surgery, did my friend's LASIK, it's got his name on the building, it's got a bunch of optometrists. Like, what could go wrong? You know, and I think that happens a lot.
And I mean, I think to me the compelling thing from these studies to me was really not so much the efficacy as the safety.
Yeah.
I mean, I wouldn't have cared if the efficacy was only 25%, but if somebody can give me something that gives me a 1 in 4 shot of big improvement with no risk, I'm going to try that before I try some drastic invasive operation, right? I mean, so to me, the primary thing is the safety. And so then, you know, consistent with what these studies said, you know, I mean, I think, you know, you've told me you've had really 0 serious complications.
No loss of vision, no retinal detachments.
No retinal detachment. I mean, so obviously no infection because there's no invasive procedure, no retinal detachment. The worst you've said is you sometimes get a slight increase in pressure, which you monitor and can be managed. So to me, yeah, I mean, I'm always going to try the safe thing, even if the efficacy was much lower. But I mean, of course, the efficacy is not that low. I mean, so yeah, I mean, I certainly would. I mean, the approach I was taking was I wasn't ruling out vitrectomy completely, but I would certainly say, you know, be much more cautious about vitrectomy. Certainly try this before vitrectomy.
Right, and you're not at a binary decision point where it's like, well, either laser or the vitrectomy. It's more along a spectrum. It's like, and I say, okay, how about we try the laser first? Let's try to get you to a position where you're a lot better. But if I can't get it good enough better, if we're just sort of stuck at 10 or 20 or whatever %, and I can't push beyond that, well, you can still do the vitrectomy. So like many things in medicine, you try the least risky, least complex thing first, do nothing, sit on that for a while, see if it gets better. It's probably not. Then like with the younger group of people, I do have the low dose atropine, but for the older group with the PVDs and all that, you try the laser. And if it's really extensive or really bad enough where I just can't get you there, there's always the vitrectomy.
Yeah. What I would say though is, I mean, the do nothing advice, which seems to be the sort of standard advice from all ophthalmologists at the moment, I would take that with a pinch of salt too, because I mean, I'm very happy that I did my own research and that I didn't do nothing for like a year or something.
Yeah.
Because I mean, it's like I said, your brain does adapt, but it's your brain adapting to terrible vision.
Right.
Which, I mean, kudos to your brain for doing that, but objectively, your vision is still terrible.
Yeah, and it's never not going to be. I mean, like with a new visual phenomenon or new anything phenomenon, it's going to be more intense at first, and you can adapt to that somewhat. But so much of our so much of our sensory input is visual, and there's no way to not see that.
I think when people talk about adaptation, what they're really talking about is it's adaptation to how annoying it is.
Yeah.
It's not really, your brain isn't adapting. I mean, your brain can't magically make your eye work.
Right.
All your brain is doing is ignoring the fact that one of your eyes doesn't work, which is, it's great that your brain can do that. But yeah, so I mean, although, I mean, do nothing for a couple of months is sound advice with almost any medical condition that isn't killing you. But yeah, I mean, I don't think, given the very low risk of this procedure in the right hands, I don't think the advice to sort of wait 6 to 12 months to see if it improves is sound advice, because from what I've seen, I mean, it's hard to get, again, these things are subjective, so it's hard to get solid data on this, but my sense is, and when I pushed my own ophthalmologist and my own retinal specialist on this wait and see advice, reading between the lines, I'm not confident that the majority of people do improve in 6 to 12 months.
I think they just give up complaining about it, and the doctors don't really hear it anymore, and they just kind of push them off there.
Yeah. My sense is it stabilizes within a month or two, and that if you haven't seen immediate improvement, I mean, given the low risk of this procedure in the right hands, I wouldn't just waste a year of your life. Because I mean, the other factor is this is happening to people at, you know, my sort of age, around 60, where, I mean, you know, a year of good vision in my life at the age of 60 is worth a lot. You know, it's potentially, you know, I mean, especially as an amateur photographer, I mean, potentially it's, I mean, because other stuff is going to go wrong with your body, right? I mean, so.
No spring chickens. Thank you for your thoughts. Thank you for your input. Thanks for sitting here and doing this.
Sure.
Again, I haven't done this for a while. I think people will really appreciate hearing a real patient's story. So thank you very much. Appreciate it.
Thanks.
All right.